Case study learning tool for third year nursing students, semester 1. Please get into groups of at least 3 people and work with the prompts from the video for each section of a primary assessment survey for your case study for your patient. One person is the patient and the others are the nurses conducting the assessment. You will need to have enough room either on the floor or on the tables in the room to conduct the case study scenario with the patient lying down. The patient is in pain and able to respond verbally. The scenario is: Mark is an 18-year-old male who fell 4 metres landing feet first while working on the house roof. Consider the mechanism of injury. So falling from height, landing feet first. What type of injuries may he have? You are handed over by the paramedics who brought him into ED that he has extensive visible open fractures on both legs. Are these injuries life-threatening and why? Is he hemorrhaging externally or internally? Collect all information from the 32 breaths a minute. His capillary refill is also greater than 2 seconds. He has a stiff neck collar in place and oxygen of 10 litres a minute via a Hudson mask when he comes in with the paramedics. Why is this and what does this mean? So you have to consider all these things for your assignment. He's also cannulated in his left cubital fossa and he has a bag of normal saline, a 1 litre bag running with 250 ml left in the bag. He has received some pain relief of morphine. This is all handed over from the paramedics. First, sum up all the information that you've been given, paramedics, for your patient. Then, in your groups, pick who's going to be the leader and we can start the primary assessment survey. Now you can stop the video at this time and we can recommence with the beginning of the primary assessment survey, starting with airway. Now that we're on to the airway, you need to be able to assess if your patient has a patent airway. If your patient is able to answer questions and talk freely to you, they do have a patent airway. If they do not, then you need to be able to open their mouth and check out for any obstruction in any way. But we've already been handed over that they do have a patent airway. They're on oxygen of 10 litres a minute. You can talk to your patient, reassure them, ask some questions. Go on to breathing. So they're on the mask, 10 litres a minute of oxygen. Their breathing is not laboured, as this has been handed over. They are tachypneic, however, with 32 rests a minute. You need to look, listen and feel. So you need to look for asymmetry of the lungs. Are they breathing at the same rate from both sides of the lungs? You need to be able to feel their lungs, feel their chest. Is there any fluid? Is there any swelling, bruising, crepitus, subcutaneous emphysema? You need to be able to listen to their lungs for any sounds, abnormal sounds, gurgling, stridor, wheezing. Also, is there any air leaking anywhere? As it is, this patient's all right with his breathing. So that's the breathing part of the assessment for your assignment. The video can pause while you conduct your breathing assessment. Now we'll start with the circulation assessment. You need to look at your patient's colour. This patient is pale. So think of what this means when the patient is pale. You also need to feel their skin. They're cool. You've been handed over as well that they're cool to touch. And check their capillary refill on their nails, and their capillary refill is greater than 2 seconds. So you need to weigh up the extent of what this means with their injuries, of knowing that they've got the open fractures in the legs. You also need to weigh up their blood pressure of 90 on 45, which is very low blood pressure. What does all this mean in your assignment? You need to consider their pulse rate, the skin colour, capillary refill, blood pressure, and the effects of the inadequate circulation on the patient. So what are they at risk of? Are they at risk of deterioration quickly? Are they at risk of dying? You need to assess this very quickly. This is all things that need to be put in for your circulation part of your assignment. Do long bone fractures cause a lot of blood loss? That's something you need to consider. And what's the consequence of this? Then they need to be triaged accordingly. Is this a life-threatening situation at the moment? You need to consider that. And what does this patient need to improve in this situation? You need to be able to stem the visible bleeding, so his limbs will need to be covered and the bleeding stem there. He needs 2 large bore cannulas. He's already got one with the saline running, so you'll need to insert another cannula on the cubital fossa. As the IV is inserted, then you need to be able to take blood for blood sugar, full blood count, and cross-match for any blood that will need to be transfused. And also early surgical intervention may need to be done. They will probably need O-negative blood to start with until the cross-match comes back. So you can pause the video now while you do your circulation assessment, and then we'll start again with the disability assessment. Okay, starting on the disability assessment, is the patient alert and responding to voice, or are they responding to pain, or are they now unresponsive? So, talk to your patient. Are they able to answer your questions? If they are, they're responding to voice. If they're not answering your questions, you can do the pain test. If they're not able to respond to that, are they unconscious? Are they not responding at all? As it is, this patient is responding to voice. Are you in pain at the moment?
Yes.
So this patient is responding to voice. You can also conduct a Glasgow Coma Scale now. Pupils are equal and reactive to light, but that isn't necessarily part of the primary assessment survey. But as we know, the patient is all right at the moment with their disability assessment. So you can turn off the video and do your disability assessment. Okay, now we're back to exposure, the exposure assessment. Clothing would need to be cut away off the patient. However, we won't do this as it's a simulation, and in a classroom situation that's not warranted. In real life, the clothing would be cut away from the patient to expose the patient to make sure that you can see any of their injuries, and if there's bleeding anywhere or anything sticking out from any part of the body. Since the patient has also got a stiff neck in place, they're very likely to have a cervical spine injury, so we won't be looking at their back as yet. You also need to consider that because their circulation was compromised and their blood pressure is low, they are cool to touch, that they're going to be hypothermic. Their temperature obviously needs to be taken, and you need to consider then trying to keep the patient warm so they do not deteriorate further. If blood products are given, the patient will need to have them warmed up to bring their temperature up. All this needs to be handed over to the medical officers that you're working with and documented. Okay, now we'll pause that while you conduct your exposure assessment, and then we can come back. Okay, now that you've conducted your exposure assessment, other tests that would need to be done in a trauma situation like this are x-rays and CT scans, probably full body CT scans because of the mechanism of injury, a FAST test, DPA test, full blood counts, packed cell volumes, UNEs and other tests that will be asked to be performed from the medical officers, as well as maybe angiography. So after your primary assessment survey, the patient's likely to go off to get all their scans and tests done. After their limbs have been stemmed of bleeding, they're on their fluids, they're probably already getting bloods, they're likely to go into surgery, and then when they're out they have a secondary assessment survey, which is a full head-to-toe assessment done. Well, good luck with your assignments, and that's the end of the learning tool. Thank you.